Hello and welcome to Almadelic. I'm Dr. Erica Zelfand. I'm a doctor specializing in integrative mental health. I also prescribe ketamine in my practice, and I'm delighted to be joining Almadelic as a medical advisor, helping Almadelic curate their medical protocols and making Almadelic's offerings as effective and safe and transformational as possible, so that people can use psychedelic medicine safely and effectively. So I'm really happy to be here. I'm really delighted to be partnering with a company that thinks about these details, that thinks about people, that thinks about what's going to help people the most with the lowest risk of harm. I joke that I'm a recovering primary care physician. I slugged it out barely made it to 5 years and then understood why. It's a dying art. And so I specialize in integrative mental health, which is actually what I did as a primary care physician too, if you could believe it. Now that's my pocket. And that includes everything from the conventional end of the spectrum to psychedelics and to everything in between, and discerning when the psychedelics are appropriate and when they aren't. And that catapulted me to found a nonprofit organization called Bright to Heal, of which I'm also the executive director, and we run retreats. And we also educate and train facilitators who want to become psychedelic-assisted facilitators. Ketamine is traditionally an anesthesia drug. It's been in use since 1970. It's actually on the World Health Organization's essential medicines list. It is the preferred anesthetic drug for all kinds of settings, not just adult settings, inpatient, outpatient, pediatrics, so, children having procedures done, also used in veterinary medicine. So sometimes people call it like petting the kitty to take ketamine because that's that reference to the veterinary use. And more recently, we're understanding that ketamine is not just an anesthesia drug, that it also has some pretty powerful psychiatric potential. When dosed in a specific way, it's also a psychedelic drug, which was not entirely intended at its onset. But looking back even to the Vietnam War, a lot of soldiers in the Vietnam War were actually taking ketamine to trip when they were having to cope with the stress of being at battle. So now ketamine has this sort of renaissance of interest in it as an off-label treatment for depression and other mood disorders, as well as one form of ketamine, S-ketamine, which now has the brand name Spravato, is actually FDA approved for the treatment of treatment-resistant depression. There's definitely a subtle art to it. So something that's quite remarkable about ketamine is it can be dosed in a variety of different dose ranges, everything from a microdose to a dose that is anesthesia for surgery. And then, in between there, we've got the dose range for taking the edge off of pain and anxiety. We've got a little bit of a higher dose where you can actually do that during a therapy session, where it's almost like having a couple glasses of wine and sort of helps drop the armoring, help you get into the thing that needs to be talked about in therapy. And then a click higher than that, you've got your just dissociative, deeply relaxed, don't want to talk. And a little bit more than that, you've got your psychedelic. And then if you go farther, people kind of lose consciousness. And that's not really what we're going for in the therapeutic range. And also, how comfortable is this person going to be with entering a dissociated state and a non-ordinary state of consciousness? Some people are ready and resourced. Other people, that's terrifying to them. They absolutely don't want to feel like they've lost control or like they're altered. And so that's where the dose can really be customized to the kind of therapy you're engaging in with the right kind of person. And then you can also customize the format of, are we doing an injection? Are we doing a nasal spray? Are we doing an oral troche? Are we doing a rectal suppository? Are we drinking it? It can be taken every which way. So we talk a lot about set and setting when we talk about psychedelic and other psychotherapeutic processes. So let's break down what those words mean. Set refers to your mindset, and setting refers to the environment that you're in. Let's talk about setting first, because it's the kind of more obvious, more tangible thing. The setting is the space that you're in. It's literally the room you're in. Are you cold? Are you warm? Is there a blanket? Is there a little fuzzy wuzzy Mickey Mouse doll that you can hold on to, right? Do you like the music? Do you like the person who's sitting in the room with you? And what we're going for with the setting, the goal of the setting is for you to feel as safe as you possibly can. Because what you're about to embark upon is a very vulnerable experience, right? Your brain is going to work in completely different ways than it normally does. Your body is going to work differently. Your reflex times are going to be reduced. Your motor skills are going to be gone. Your ability to like throw a punch or defend yourself physically is pretty much gone, right? And if there is a part of you that is still scanning your room going, okay, there's going to be a fire. What's going to happen if this person attacks me? What happens if the dog needs to go out and I can't let the dog out, right? It's going to pull your attention outward instead of inward. And what this medicine does is it really beckons you inward to do the work that you don't normally get to do in your typical waking consciousness state. And so if the setting isn't ideal, you're not going to be able to go as deeply as you want to go. Or worst case scenario, if the setting isn't ideal and you feel that you have to stay alert and vigilant and ready to fight while you're on a drug that's pulling you in the opposite direction, that can actually be experienced as a harm, as a trauma to a person. And so that's why getting the setting dialed in is super important, right? Especially whoever is with you is somebody that you trust. It's really, really important. And I experienced this personally. The first time I had a ketamine session, I was in a professional clinic. It was a professional setting. And I had a lovely ketamine playlist that somebody shared with me, and I put in my headphones. But my Spotify account was a free account, and I kept getting commercials. And so when I was like literally surfing in the metaverse and then peeling back the sub-basement of my consciousness and looking at the skeletons under there, I was hearing advertisements for like menstrual products and bras. And it was really confusing and annoying. And then my motor skills weren't, so I couldn't hit the next and navigate, and really pulled me out of the experience, right? Just even something little like that. And I thought the picture on the wall was a really creepy looking fish. And then like I saw that in my trip. It's like, and it was cold in the room, right? So the next time I went back, I had the music all dialed in. I actually brought a scarf and put it over the fish painting. And I brought some cozy socks and a shawl with me. And the amount of material that I was able to heal, same drug, same amount of time, right? But a different setting, remarkably different. So the goal of setting is safety. You want to be physically safe. You also want your brain to know like, okay, I'm safe. So that's the setting. Then there's the set. The set refers to your mindset, means like what's kicking around in here when you go into your experience, right? Did you just have a fight with your partner? Did you just have a fight with the receptionist at the front desk of the ketamine clinic about your bill? And now you're taking that into your session, right? So this is a perk to Almadelic. You don't have to deal with any of that. Did you ding your car in the parking lot on your way into the session? Another perk to Almadelic. We don't need to deal with that sort of thing. Are you afraid because you didn't ask all the questions you meant to ask during your intake appointment? And now you're about to take the substance that you're afraid might break your brain, which, by the way, it won't, right? And then you take the substance and you're afraid your brain's going to break. And then what kind of experience do you think you might have? So for these reasons, to optimize the set, the mindset, I often recommend to my patients that in the days leading up to your treatment, don't read the news. Don't watch the news. If you're watching TV or movies, steer clear of really disturbing material or violent material, anything really graphic. And on that note, I also recommend not watching pornography for a few days before the session. Because whatever's kicking around in here
it's going to kick around in here potentially in an amplified way once you're in the medicine. And that isn't always a bad thing. Sometimes it's kicking around because it's ready for you to heal it. Sometimes it's kicking around because it's just distraction from the work you actually need to be doing. So being mindful of how you're entering the space and physically what the space is that you're entering before you enter the mind space with the medicine. And we really harp on set and setting because they are some of the biggest controllable elements to whether or not you have a healing experience on the substance.